It's been a bumper week for vaccinations, 2 million more shots in arms nationally and a couple of chuffed leaders.
There's no doubt that at a particular point we'll be saturated. Everybody who wants the vaccine would have taken it. Dr. Chant and I are hoping that'll be like 90 plus.
We know that as the vaccination program hits these marks, it just gets us closer and closer to be able to open up more parts of the country and seeing the economic recovery follow soon after.
Young teens extra keen to do their bit. In less than a fortnight, 23% of 12 to 15-year-olds around the country have already had at least one jab. That number jumping to almost 35% in New South Wales.
Given that's only been available in a short period of time, that's an outstanding result.
But drill down and many regional vaccination rates are well below average. Locals worry the virus could overwhelm them once the state opens up at 70%.
What we're asking from the Premier and the Deputy Premier is that they give the regions some time to catch up to the vaccination rates that we're seeing in Sydney, because we are behind, and a lot of that is due to a lack of supply.
Whilst we appreciate all those concerns expressed by people, we will make the cautious decisions based on the health advice, and we'll make those decisions as we approach that 70%.
Over the border, Victoria's falling behind its own targets. The state was predicted to reach 80% first dose this Sunday, now expected sometime next week.
The more Victorians who come forward over this weekend to get vaccinated, the sooner we'll get there.
Vic authorities rushing in Moderna jabs amid reports all states and territories have been warned of dwindling Pfizer allocations.
We were very pleased to allocate from the Commonwealth 32,000 Moderna vaccines, essentially to make sure that we do not lose the momentum.
But the head of the Australian rollout says any new federal government Pfizer fears were short-lived.
We are receiving the 9 million doses that we expect in October. That's the assurance that we've had.
Well, epidemiologist Professor Nancy Baxter joins us now. Nancy, New South Wales regional MPs really concerned about Sydney-siders seeding the virus into their communities when that state opens up. Isn't this a problem nationwide, though, because the vaccine rollout is so unevenly spread?
It absolutely is. And the whole thing is, if you have geographic areas that are underprotected, the Delta is going to find them, the virus is going to find them, and it's going to have an opportunity to create outbreaks there. And they tend to be in areas that are pretty vulnerable in terms of access to clinical care, and are not really in a position to kind of adequately deal with an outbreak in terms of hospital rates and that type of thing. So I think that these regions are right to be concerned. And, once Sydney opens, it is going to spread to the region. So it's going to be difficult to control there.
And half of all of over 16s are now double vax. But are we doing any better with those vulnerable Indigenous communities who have been proving so hard to reach?
Well, it's kind of very similar. As of last week, they were still, Indigenous communities were still about 20% under the vax rate for the rest of Australians. And so again, it's these pockets of people in geographic areas that are going to be particularly at risk when the country opens up. And those populations, those people are at risk too, because they tend to have more chronic conditions that make them more likely to get severe COVID. So it's just really not acceptable to think about, we've been focusing on Sydney for good reason in terms of getting the vaccine up. But just because you achieve a high level of vaccine, and mainly that's because of great rates in Sydney, you can't just kind of let everybody wander everywhere in the state, because it's going to have a big impact. It's not going to take that long to get the rest of the regions up. And if there's a concentrated effort, we can absolutely do it in Indigenous populations too. And we really need to do that before we let COVID spread to those areas.
Well, Atagi says immunocompromised people will likely need a third jab. What's the difference between a third jab and a booster?
Well, it's kind of semantic, but a booster would be for people who've achieved a good level of immunity from their immune system has reacted well to the vaccine. But then over time, the immunity has waned, what we call waned over time, just like with a tetanus shot. You get your initial tetanus shots, and then 10 years later, you need another one. But there are some people who don't get an adequate immune response in the first place. And so those are people that need a third dose to, get their immune response to an adequate adequate level from, the initial course of vaccination. And so that's what they found with people who are immunocompromised. So people who've had a kidney transplant or on chemotherapy or are on drugs that suppress their immune system. So, those people likely need a third dose as the first course of treatment, and then probably will need boosters afterward.
Nancy, you paint a pretty worrying picture of what might happen if in fact the nation opens up too soon. What are the implications for all of these regional areas right across the country which don't have the same resources in terms of healthcare?
Well, obviously taking care of COVID is really resource intensive. And that's just from taking care of people on the wards who aren't extremely sick but need oxygen and need care, to, the ICU care and having to transport many people down to major centers from regions. So it's going to be a huge tax on all of the healthcare systems around the country, but particularly, if we allow it to really spread in the regions and big outbreaks in the regions, it's going to be really hard there. The other thing is, as we've seen in Sydney and in Melbourne, often hospitals are a site of infection, and sometimes many hospital workers need to be furloughed because they've been exposed. That's hard enough to deal with in a big center like Sydney or Melbourne when there are lots of healthcare workers. But when you're in a region that has very few already, then losing a small number of them can actually be critical and kind of stop the healthcare system from actually functioning. So these are pretty fragile systems. So, not protecting them to the best we can. I mean, we have to open up, but we need to make sure they're protected the best we can so that we don't kind of, it's an own goal. If we let things really spread in the regions without making sure the regions are protected, we're doing this to ourselves and we can do better.
Nancy, good to talk as always. It's Friday night, so you're officially off the clock from now. Thanks.
Thanks.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.